Hi everyone, this is Prakash. I am a sports physiotherapist. I am just sharing this video to help and educate the people regarding how the cold weather affects your joint pain and how you can prevent it. So basically there is a science behind it, it's not a psychological thing like when the temperature is getting down, you're getting the pain. So there is a science behind it when you are getting your pain aggravated in cold weathers. So there are three different theories that I'm going to talk about, and I'm going to talk about in very simpler terms so that anyone like who has a basic science background, they can understand the things, and I'll try to keep the words simple. Yeah, okay. So first perspective is physics perspective. So when the temperature outside gets lower down, the pressure, atmospheric pressure, is also getting lower down along with that. So you can just imagine we have some pressure inside our joints as well. When the outside pressure drops down, the pressure which is there inside the joints tries to stretch out the joint capsule. Joint capsule itself is a very sensitive structure which appreciates a bit amount of stretch as well. So you can just imagine like something is just trying to stretch outside because of the increased pressure inside the joint as the atmospheric pressure is getting down. This is the physics perspective behind the joint pain increase in winters. Now I'm going to talk about the physiology and neurology behind it. When the temperature drops down, the sympathetic system, which is the automatic system in our body, this gets activated. It increases the amplification of pain signals. So you can definitely understand when something is getting amplified. So the perception is also getting amplified. So increased amplification of pain signals leads to increased pain perception. The third one is the biochemistry, which is a bit interesting one. So as we all know, like 70% of our body is water only. Now imagine a wooden stick which is dry and another one is wet. So what do you think is more flexible? Definitely we know the answer, like the wet stick will be more flexible. 70% of the body is water only. We have less water intake in winters because we feel less thirsty during these days. So less water intake is reducing the 70% amount which has to be there. So the body takes up the water from skin and muscles to make sure like the vital processes are going on properly. Okay, so vital processes are going on and leaving the muscles and skin dry and stiff. So when the muscles are going stiff, pressure on the joint is increasing because the muscles are like levers. They are working on the joints like levers. So the compression on the joint increases when the muscle stiffness is increasing. Okay, so that's another interesting thing why you get more pain in winters. Now I'm going to talk about the connection, how the physics, neurology and biochemistry is connected towards it. So first I'm going to talk about the biochemistry and the physics connection. Increased stiffness in the muscle leads to more compressive forces on the joint. As I was talking about, it is working on the liver system, so increased stiffness in the muscle leads to more compressive forces on the joints, leads to more wear and tear. Now, how the physiology and neurology is connected to this? So this is physiology, neurology and the biochemistry connection. So when there is increased wear and tear, there is increased inflammation as well at the same time. Increased inflammation along with, as we talk about, this amplification of pain signals which leads to increased perception of pain. So here 2-3 things are working synergistically to appreciate your body more sensation of pain. I'm not smiling and laughing, it's just like this fact is very interesting and the science behind this whole thing is very integrated. That's why I'm trying to connect all these things, all the theories behind it. Now I'm going to summarize the whole thing, like how the whole package is troubling you out. So physics, physiology, neurology and the biochemistry behind it. Increased pain perceptions leads to withdrawal of physical activities, further enhancing stiffness in the muscles, and here the bullet of physics is hitting directly on your joint. So it's like increased pain perception leads to withdrawal of physical activities, which leads to further stiffness, and this is a cycle going on, and the bullet is getting bombarded again and again by the physics.